All of the physicians at Cancer and Hematology treat most types of cancer, but we do have some specializations. I see a lot of breast cancer, so that would be one of the areas that I'm particularly interested in. I think it's the people that work at Cancer and Hematology, the doctors and the nurses and the office staff, the lab technicians that work here really have a dedication to taking care of patients. And I think that shines through when patients come here, but I think there's not a single person that works in this office that doesn't care about what happens to each individual patient, and I think it's a good working environment in that way. Probably mostly the patients, and that's still very important to me, but it's turned out to be a very fast-moving field with a lot of breakthroughs, a lot of scientific discoveries, and so there's a lot that goes into the reason that I like practicing oncology, but I think coming back to the patients and trying to help people in a very difficult situation get through that is rewarding. There are so many breakthroughs in oncology right now in the past 1 to 3 years in breast cancer, lymphomas, any type of cancer that you can imagine. There are new breakthroughs right now. You could never name just one. And they're all, they're all being used here. I don't know that there's that much of a difference. There used to be a big difference between academics and what was offered at an academic institution and private practice and what was offered in a private practice office. But that division has really gone away. The breakthroughs that are available at large institutions in this state and elsewhere, and they're also available here. There's not that much of a difference anymore. There are some areas where rare cancers are seen at a large center, and there are doctors with expertise in taking care of those, but I think the gap between, academic practice and tertiary institutions and private practice has really narrowed. I think we offer a lot of support to family members at Cancer and Hematology, and I think one of the things that we've really focused on and that is very important in the treatment of cancer is to treat not only the physical problem or the cancer, but also to support patients emotionally, and I think we have a good structure in this office to do that. And I think that's a big battle for people. Sometimes it's more than 50% of the battle is not the physical thing that they're going through, but the emotional thing that they're trying to get through, and that encompasses not only the patient, but their families. And I think that this practice in this building has really focused on supporting patients and their families through that experience. And that's a big part of cancer care.